What mom eats while breastfeeding doesn't just affect her, it can shape baby's feeding too. Let's go through what tends to help and what to watch. Oats are one of the most commonly mentioned foods for milk supply. Easy to add to breakfast in just a few minutes. Fenugreek is a traditional herb many breastfeeding mothers use, though it's worth checking with a lactation consultant on the right amount for you. Leafy greens like spinach bring iron and calcium, both of which stay in demand during breastfeeding. Salmon is a good source of DHA, which passes through breast milk and supports baby's ongoing brain development. Almonds provide healthy fats and a bit of calcium, an easy snack to keep nearby during long feeding stretches. Garlic has a bit of a reputation here. Some studies suggest it can even encourage baby to nurse a little longer. Sweet potatoes bring complex carbs and vitamin A, helping keep energy steady through busy feeding days. Brewers or nutritional yeast is another one frequently mentioned for supply, and it adds a subtle, savory flavor to food too. And simple as it sounds, staying well hydrated is one of the biggest factors in maintaining supply. That's 9 things that tend to support supply. Now, a few worth watching. Peppermint and sage tea are 2 herbs often flagged as ones that can reduce supply in larger amounts. Occasional is usually fine, but worth watching if supply feels low. High caffeine intake can pass through breast milk and affect baby's sleep. Most guides suggest keeping it moderate. Alcohol passes into breast milk too, so timing and amount matter. Many guides suggest waiting a few hours after drinking before nursing and checking with your provider on specifics. High mercury fish like swordfish or king mackerel are usually the ones to limit. Smaller, lower mercury fish like salmon are the better everyday choice. So weird. A few to watch, and a longer list that tends to work in your favor. Overall, a varied, balanced diet tends to matter more than any single supply food. If supply feels like a real concern, a lactation consultant can look at the full picture, not just diet, but latch, frequency, and more. However your feeding journey looks, small, consistent choices add up more than any one perfect day. Oats, fenugreek, greens, salmon, almonds, garlic, sweet potatoes, nutritional yeast, and water. Those were today's supportive picks. And peppermint, sage tea, excess caffeine, alcohol, and high mercury fish were the ones worth watching. Always check with your doctor or lactation consultant about what's right for you and baby. Follow for more postpartum nutrition basics.